Good afternoon, everybody. Welcome to the first of our three-part webinar series on all the different changes that are coming to our child care and parent services program and many other programs here at DeKalb. My name is Bentley Ponder, and I'm a Deputy Commissioner here at DeKalb. I'm been here 20 years and just really excited to still be here and excited to work with all of you, and hope you're having a great day. All right, next slide, please. So, as I mentioned before, that these are our three different webinars. Today, we're going to specifically talk about some new CAPS policy changes that went into effect July 1st of this year. And then we're also going to talk about the conclusion of some of our programs that have been funded through our American Rescue Plan and some of our other COVID-19 pandemic relief dollars. I am here with several colleagues that I'm excited that will be sharing with you. So right next to me is Elizabeth Casper, colleague, Deputy Commissioner with CAPS, and she'll be talking about some of the big picture changes and some of the contextual points with CAPS. I'm also here with Ann Panzica, who will be talking about some of the new changes related to access and some provider relations information. And then I'm also here with Olivia Kyle and Arletta Huffler-Jones, who will be talking about just some of the new emergency policy waivers and just some of our new eligibility requirements. So we have a lot of information that we're going to share with you. You'll note from the slide that this is, the webinar will be posted. We will also be posting an FAQ. So you should see at the top of your screen or somewhere on your screen a Q&A. You can put the questions there. We have a few minutes at the end where we'll answer some questions here, and what we can't answer, we will put into an FAQ and we will answer later. I will say after years of doing these that many times people put in questions really quickly, and those questions will subsequently actually be answered later in the presentation. So I do encourage you to maybe wait till the end of the presentation or as we come to the end before you put in your questions, because I have a suspicion a lot of those will be answered. All right, next slide, please. So, as I mentioned before, there is our agenda. We will first, hit on the overview, talk about the policy updates, some emergency policy waivers, and then we'll also do some updates around provider relations. And then, as you know, we'll have a few minutes at the end for Q&A. And then before I turn this over to Elizabeth, I want to just mention, and I almost would call this a disclaimer. The team here, we've worked really hard on designing these webinars specifically for providers. And I say that for two different reasons. One is I want to make sure all of our providers are listening and know that interspersed with all the policy changes and some of the big program changes, also be some very specific instructions for you related to the CAPS program that I know you're going to want to hear. And then I also say that because I know that we have a lot of stakeholders, and I know we even have some of our staff and some of our CCR&Rs that are listening to the webinar and are excited to hear about the new changes, want to know what's going on, but just know that for you that these webinars are geared towards providers, so you'll have a lot of technical information interspersed with those policy details. And with that, I will turn it over to Elizabeth.
Thank you, Bentley. I'm Elizabeth Casper. I'm the Deputy Commissioner who oversees the Child Care and Parent Services, or CAPS program. And I want to just set up the stage a little bit for what we're going to talk about today and give kind of, as Bentley mentioned, the big picture as to why we have to make some of these changes, as well as what they are. And then the people who go after me are going to go into a lot of detail about those specific changes so that you know exactly what's going on. So many of you may be aware already that CAPS is federally funded through the Child Care Development Fund, which is we call CCDF. You'll hear it referenced that way. And of course, DeKalb is the lead agency. CCDF pays for CAPS as well as many of the other programs DeKalb administers and the functions that DeKalb carries out. Since 2021, DeKalb has supplemented our CCDF funds with COVID-19 relief dollars that are expiring at the end of September. We actually are required to have spent all those funds by the end of September, just to be clear about that. And then those relief dollars that I was talking about allowed CAPS to pay childcare providers their full published rate and to expand to serve over 72,000 children. So that would be our access initiative. And then when we expanded eligibility in the program back in November, I think, or October, November of 2021 for a year. And so those are initiatives that those extra funds paid for. And in addition, there were many other initiatives. You're all, I'm sure, very familiar with the Stable Grant. That was one of the big ones, but there are other grants that have been available over the past few years and other initiatives and programs that have also been paid for with those relief dollars. And then, as many of you may remember who have been CAPS providers for several years, that CAPS is really designed to serve 50,000 children at any given time. And prior to these initiatives and prior, especially the expansion one that I mentioned, and prior to the pandemic, that's how many children that we typically served and that our funding from CCDF supports. Next slide, please. So in this and the other two webinars, we're going to be talking about what changes are happening now and in the coming months. Those include reducing back gradually from the current number of children being served in CAPS to the previous service level of 50,000 children. Changing eligibility requirements is our mechanism that we use in order to do that. This means changes to the emergency payment waivers and initiatives like Access and the increased tiered reimbursement coming to an end, as well as different rates paid to providers for the CAPS services. Next slide, please. The reasons that these changes are needed fall into essentially three different categories that you can kind of see on the slide. The American Rescue Plan funding ending. So as I mentioned, these funds have to be spent by September 30th. And as I also mentioned, they were used to pay for Access, increased tiered reimbursement, Stable, and some of the other initiatives. And most importantly, to pay for the expanded number of children that were in our program, where we were able to serve at the highest point over 72,000 children, which I think is roughly a 40% increase from our typical service level. So the additional funding that DECAL had is ending at the end of September, as I mentioned, and that's why the Access Initiative, increased tiered reimbursement, are ending at that time as well. The second sort of bucket or category of a reason is we have recently been issued new rules. So just like DECAL issues rules for CAPS, for childcare licensing, the CCDF, or the Office of Child Care, issues rules that we have to follow in order to administer the things like the CAPS program and all the other requirements of the Child Care Development Fund in order to get that funding. So this past spring, they issued new rules that states have to implement. Georgia has applied for waivers for a few of these rules. We're already in compliance with at least a couple of them. And then they have issued, or we have, applied for waivers to try to give ourselves some time to implement some of the others because they are fairly large and impactful. So those rules that I'm talking about, which you'll hear more about, I don't want to go into them too much here because we have a lot to cover that's more immediate than those, but those rules could also have an impact on the number of children that we serve beyond even being able to serve 50,000. So we're looking at that right now. And, but we have to make some changes now in order to prepare for those rules as well as what I've already mentioned. Then the third category that you see on the slide is the new CCDF plan. So our requirement of those funds and those rules I mentioned is that we have to submit a plan every 3 years. And that plan that you've heard probably about this spring, because there was a couple of, I think, public hearings and we've sent out notices about it, is a proposed plan as of now, but we hope will be approved. And that would become effective also October 1st, officially, of 2024. Of course, for CAPS, our service week happens to start on September 30th. So when you keep hearing these different dates, that's why. But those new things that are in that CCDF plan would start then. And that will include new rates for childcare providers. Our next webinars are going to focus a lot more on some of that information and how processes that surround access ending and new rates and what those are and how they came about. But so we're also not going to go into a lot of detail about that today, but do know that there are new rates coming. And at the time of the second webinar, we will be sharing what our rate table looks like. And so I think you can look up the current, the one that was basically the last time we updated rates. So it's not, we're paying you your published rate right now through Access, but the rates that we have on file for the state maximum reimbursement rate are posted on our website now. The new rates are not posted yet, but they will be posted in a couple of weeks when we do the next webinar, so that you can see what you can see what they are. Next slide, please. So in summary, the changes in federal regulations, the end of the relief funding, and the new CCDF state plan mean CAPS needs to make some policy changes. CAPS needs to reduce back to serving 50,000 children, and CAPS will be paying new rates beginning with service week starting September 30th, 2024. I want to acknowledge and recognize that these changes are not going to be easy for the childcare community, for providers, or for families, because anytime we drop things back from a higher level than they were, everybody feels that, and both, especially providers and families. So I want to recognize that we understand that, and that we are doing everything that we can to minimize the impact on childcare providers, the workforce who works in the childcare industry, and of course on families. Next slide, please. So we will continue to communicate with you regularly and to be transparent about the changes that are being made and the reasons for them. We're going to offer resources and supports wherever possible to help make changes understandable for both childcare providers and for families, and to help in any other ways that we are able to do. And then I just want to say for the record, we're all going to be learning and adapting together to all these changes that are going to require patience and probably some bumps in the road, even though we will do everything we can to make everything as smooth as possible for everybody. But as we acclimate to everything, I think we all just need to acknowledge that there are a lot of changes, and that we're going to go through this together. We're going to get through it together. And with that, I am going to turn it over to Olivia Kyle, who is going to take you through the specific CAPS policy updates that are effective, I think, already as of July 1st.
Yes, it is. And thank you so much, Elizabeth. Good afternoon, everyone. As Elizabeth stated, my name is Olivia Kyle, and I am the Policy and Process Improvement Administrator for the CAPS program. And I will be sharing the CAPS policy updates that became effective July 1st, 2024. Now, I know that these changes apply to families, but we wanted to share this information with you because you all work with families so much. Next slide, please. So we wanted to start with how were providers notified of the July 1st CAPS policy updates I'm about to share. Providers with a valid email address on file were notified last week with the letter you see on the screen. Providers without a valid email address receive this letter in the mail. All communications about CAPS changes are posted on the CAPS updates webpage at caps.decal.ga.gov/en/updates. So anytime that you receive a communication from CAPS and you want to see like previous communications about policy, you can go on this website. So now I would like to discuss those policy updates starting on the next slide. The following updates went into effect July 1st, 2024. So families experiencing domestic violence, families who have experienced a natural disaster, and families who lack fixed, regular, adequate housing, those families in those priority groups must now meet state-approved activity requirements. The second change is families with children enrolled in Georgia's pre-K program at initial or previous eligibility determination must meet priority group eligibility requirements at redetermination. The third change that we're going to talk about today is the grace period for families submitting missing verification documentation has been reduced from 90 days to 45 days. And finally, regarding the July 1st policy revision, we're going to talk about the reduced threshold for the very low income priority group. And I'm going to talk about each of these changes in more detail. Next slide, please. The first change we're going to talk about is the state approved activity requirements for the families experiencing domestic violence, families who have experienced a natural disaster, and families who lack fixed, regular, adequate housing priority groups. These groups are now required to meet the average of 24 hours per week as their state approved activity at initial eligibility and redetermination. And activity requirements could be met by employment, education, or training, or a combination of all of those. Previously, these three priority groups were able to use job search as a state approved activity for the entire eligibility period at initial application. Families who lack fixed, regular, and adequate housing priority group was also able to use job search at redetermination if they still met those priority group requirements. This impacted eligibility requirements, Section 6, priority groups, Section 7, and redetermination, Section 14 of CAPS policy. And these activity requirements will apply for new applicants, applications with an application receive date on or after July 1st, 2024, and for redeterminations, cases with a redetermination due date on or after July 28, 2024. Next slide, please. Additionally, there were some changes to policy related to job search and job search related activities for those families and the families experiencing domestic violence, families who have experienced a natural disaster, and families who lack fixed, regular, adequate housing priority groups at initial eligibility and redetermination. Parents are no longer able to participate in job search and job search related activities for the entire 12-month eligibility period. Impacted policies include CAPS eligibility requirements policy section 6 and CAPS priority group policy section 7. And the revised activity requirements apply to for new applicants, families in these categories seeking initial eligibility, meaning new families applying for the CAPS program. And for redeterminations, families in these categories awaiting redetermination, meaning that they already received CAPS and they're being redetermined for eligibility. However, I do want to point out that job search has not completely gone away from our policy. Job search is still available when parents report that they lost their activity, such as employment or education, during the eligibility period. They can get up to 13 weeks job search from the time their activity ends. This applies to families in all priority groups. So again, job search has not completely gone away from the CAPS policy. The changes that you all see on the screen are the changes pertaining to job search. Next slide, please. One more update I wanted to share about the families who lack fixed, regular, and adequate housing priority group. The language in CAPS Priority Group Policy Section 7 was updated to remove verbal attestation or client statement as acceptable verification for this priority group. This applies to new applications received on or after July 1st, 2024. Next slide, please. The second policy change that went in effect July 1st, 2024 is pertaining to families of children enrolled in Georgia's pre-K program priority group at initial or previous eligibility determination. These families must be determined eligible for a priority group at redetermination. Effective policies include CAPS Priority Group Policy Section 7 and CAPS Annual Redetermination Policy Section 14. Priority group status is not required for most families at redetermination, but is screened for applicable policy exceptions. And for this revision, this applies for redeterminations with a redetermination due date on or after July 28, 2024. Next slide, please. Right. Something to keep in mind if a family is requesting verification of Georgia's pre-K for their child. So we wanted to talk about the previous school year and the upcoming school year. So some of you all may be wondering, can a family qualify under the Families of Children Enrolled in Georgia's Pre-K Program Priority Group if the child will be enrolled in Georgia's pre-K for the upcoming school year? The answer is yes. Families may qualify under the Georgia's Pre-K Program Priority Group at any time during the pre-K school year for the current school year or the upcoming school year with acceptable verification. For example, if a family is determined eligible for CAPS and their eligibility period is from July 1st, 2024 through June 29, 2025, and CAPS verifies that the child will be attending Georgia's pre-K in the fall 2024 through 2025 school year, as an example, then they can qualify under that priority group. Acceptable verification includes Georgia's pre-K enrollment status verified through DECAL's pre-K database system or completed CAPS Georgia's pre-K referral form, Appendix S, if the status cannot be verified through the pre-K database system. So in other words, CAPS staff will try to verify the Georgia's pre-K status on our end. And if we're not able to verify that information, then the CAPS Georgia's pre-K referral form needs to be completed. And I'll talk about more about that form on the next slide. Also, for the previous school year, for example, 2023 to 2024, families will not qualify for the Georgia's pre-K priority group because the child is no longer enrolled in Georgia's pre-K. And also, I wanted to point out that children in private pre-K, not Georgia's pre-K, are not considered eligible for this priority group. Next slide, please. So I talked a little bit about the CAPS referral form on the previous slide, and I wanted to spend a little time talking about the form on this slide. So the CAPS pre-K referral form, Appendix S, is used if a child's Georgia's pre-K enrollment cannot be verified by DECAL's Georgia's pre-K database. As of July 1st, 2024, this form has been updated to include a portion that must be completed by providers. So the way the form is set up, the information on the top is filled out by the parent, and the information at the bottom where it says provider information, that is to be completed by the provider. So parents may bring this form to your facilities and ask to verify that their is in Georgia's pre-K. And if a parent does bring this form to you as a provider, providers will need to fill out the name and address and phone number of the Georgia's pre-K site and signature. This document is available on our CAPS website as well. You can go to the next slide, please. Now, let's talk about the third policy change that went into effect July 1st, 2024. And this is regarding the grace period. The grace period for families submitting missing verification documents has been reduced from 90 days to 45 days. So some of you may be wondering, what is a grace period? So in short, a grace period is the additional time frame families receive to submit missing verification documents after an initial application or redetermination is processed. All families may receive a grace period for citizenship and or immunization requirements if verification is not available at the time of eligibility determination. Additionally, families experiencing domestic violence, families who have experienced a natural disaster, and families who lack fixed, regular, and adequate housing priority groups may also receive a grace period to submit income and activity documentation if verification is not available at the time of eligibility determination when their priority group status has been confirmed. Next slide, please. So the fourth change that we want to talk about is the threshold for the families with very low income priority group. So as of July 1st, 2024, the threshold has been reduced to 10% of the federal poverty guidelines. So applications with the application receive date before July 1st, 2024 will reflect the 50% of the federal poverty guidelines as indicated in the red box on the slide. And if you go to the next slide, for applications with the application received date on or after July 1st, 2024, the very low income priority group limits have been reduced to 10% of the federal poverty guidelines for those applications. So with that being said, thank you all for listening. And now I am going to pass it on to my colleague, Arlette.
Thank you, Olivia. Good afternoon, everyone. My name is Arlette Hoffler-Jones, and I am the CAPS Policy and Process Improvement Coordinator. And today I'll be going over the CAPS emergency policy waivers. So 4 years ago, the CAL waived certain CAPS policies to support families and childcare providers that were impacted by COVID-19. Next slide. So all of the emergency policy waivers that I'm going to discuss are in the emergency policy memorandum. So the CAPS emergency policy memorandum contains all past and current policy waivers in effect. And the policy waivers in this memorandum supersede applicable policies contained in the CAPS policy manual. This document is revised when a policy waiver is updated. We have a snippet of the memorandum on the screen. To view it in its entirety, you can visit caps.decal.ga.gov/en/policy. You can also find it at caps.decal.ga.gov/en/updates. Next slide, please. So as you all know, the CAPS emergency payment waiver ended a few weeks ago on July 11th, 2024. The emergency CAPS payment policy waiver was implemented in 2020 during COVID to make sure providers can continue to operate or pay teachers if there's low enrollment or a temporary closure. Since the nationally declared public health emergency ended in May 2023, the time to use the funding that supported that waiver is over. And the former CAPS policy has resumed. So CAPS will not pay if the child did not attend at least once during the service week except when providers are requesting payment to hold a slot and they meet the requirements for holding slots. So there'll be more details to come on the holding slot policy later in the presentation. The CAPS will not pay if the child care provider was not open for care at least 1 week during the service week, and CAPS will allow providers to charge families when a child did not attend at least once during the service week per policies in place for all children. When a child does not attend, providers may request payments from families for children subsidized by CAPS based on the rate that they have on file with CAPS. Next slide. So providers are no longer able to use the COVID billing option in Georgia CAPS, and you must select at least 1 day of attendance for all children with active CAPS scholarships to receive payment unless you are selecting that holding slot policy that I mentioned earlier. And now I'll briefly discuss the remaining emergency policy waivers that are still in effect. So the policy waivers that we're going to go over are all connected to the Access Initiative that will be ending September 29th, 2024. The first policy waiver I want to review is the temporary suspension of provider rate changes emergency policy. So as you know, you're not able to update your rates for families enrolled in the CAPS program. This is to support families and to ensure the CAL paying child care providers their published rate is sustainable through September 2024. And providers received a 7.87 increase in rates in October 2022 and a 4.3 increase in January 2024 to their published rates. The next waiver is the provider rate charged for children not subsidized by CAPS waiver. So even though you're unable to update the rates charged for CAPS families, you can charge a private pay family a different rate. And this is to allow CAPS providers flexibility while access is still in effect. So those two waivers are still in effect until September 29th. Next slide. The third waiver is the emergency CAPS maximum reimbursement rate policy waiver. So normally CAPS pays the state maximum reimbursement rate and parents pay the difference between what CAPS pays and what the provider charges. However, with the increased funding received, CAPS has been paying child care providers their published rate from May 17th, 2021 through October 1st, 2023. CAPS paid providers their published rate, including the family fee. Effective October 2nd, 2023, families began paying their family fee, but CAPS continues paying the rest of the tuition. And the last waiver we'll review today is increased in quality rated tier bonus payments, which will also continue until access ends. And this means that CAPS increased the quality rated tier bonus payments by 15% per star level. So you'll hear a little bit more about maximum reimbursement rates, provider rate changes, and the upcoming End to Access later in this presentation. So this was just to give you an overview of the CAPS emergency policy waivers. If you do want to look at a complete list of and detailed information on each policy waiver still in effect, you can go to the CAPS emergency policy memorandum that I referenced earlier. And again, that's on our CAPS website under the updates tab or under the emergency policy updates tab. So that's all I have for emergency policy waivers. So now I'll turn it over to the provider relations team.
Good afternoon, everyone. My name is Ann Panzica, and I am the Provider Relations Education Outreach Manager. Next slide, please. So there are some upcoming changes to tell you about today. Effective after the service week ending September 29th, 2024, the Access program is ending. And that Monday, September 30th, the state maximum reimbursement rate is changing. I know that you are all eager to know what the updated state maximum reimbursement rate is, and we will be discussing that at length when we have our upcoming webinar that I'll be telling you about shortly. You can also view the CCDF proposed state plan and see the proposed state maximum reimbursement rate there. So due to these changes, you will be able to update your published rate in Georgia CAPS, which I know a lot of you have been wanting to do. So after September 29th, CAPS will no longer pay the differential. So the differential is the difference between the amount that CAPS pays and the provider's published rate. So families will now be responsible for paying the family fee and the differential. We will, of course, be updating families about this change and will also be notifying them by letters. So we have asked some providers, we have had some providers ask about policies and processes. One question that's been asked is the policy regarding holding slots. So what holding slots is it allows the CAPS provider to authorize payment for a maximum of 2 service weeks during the eligibility period when a child is absent from care. So the provider must be open for business in order to receive payment for holding slots and must provide specific requirements for holding slots in your policy. So this policy must be on file with CAPS. In addition, the child must have attended the provider in person at least once to claim a holding slot. Next slide, please. So you must have holding slots in your policy for it to be applied. To check if your policy is in Georgia CAPS, log into the provider portal and then navigate to your documents library. You can see right there where it is. Next slide. So you will be checking in the policies and procedures section of the document library. Next slide. And then you're going to select that eye icon right there that you can see to review the policy that we have on file. Next slide. You can also see holding slots if it's in your policy, if it appears when you mark that a child was absent. So that's another way that you can see it. Next slide. If holding slots policy is current in your policies, but is missing from the copy that we have on file, you can upload a recent copy in Georgia CAPS during annual renewal. If you would like it applied sooner, please email CAPS provider support with updated holding slots policy in the subject line. Next slide. So there are times, such as July 4th, when you may have been closed one day, but open the rest of the week. To make sure that you're paid for this week, you will select yes, that you were open for the service week, and then you can complete attendance for the days that the child attended. Next slide. If you submitted attendance already, but marked it incorrectly, there is a way to change it after the fact. So you're first going to navigate to the request payment adjustment correction in the Georgia CAPS portal, and then submit a payment request from the drop-down reason, and it's called marked no care and error. And then you're going to select the service week that you need to modify. Next slide. You will then mark the attendance based on the sign-in, sign-out sheets for the child and select save. You may have to also upload your attendance records for that service week as well, and you will be prompted to do so. Next slide. So for payment requests for marking no care and error, there's a 30-day window after you submit the request. So once the payment request is approved, you will be notified, and the payment will then follow the next payment cycle. Okay. So with these upcoming changes, we want you to stay notified of all of these different changes that are occurring. So we will be notifying you via emailed letters, so be sure to check your email to stay informed. And in addition to that, we'll be updating our webpage regularly to include updates. And this webinar will be recorded and housed there as well. So please also be checking your Georgia CAPS portal, because we'll be sending bell notifications there and also banners to relay that important information. So there are 2 different types of notifications that you can see in the Georgia CAPS portal. The bell notification is shown right there on your screen, is on top of the dashboard. And then the banner is located right there where it says important notification. And those are both utilized by CAPS to provide reminders and updates. Next slide. So we are going to go ahead and open up the floor for questions. And I just want to say thank you so much for spending this time with us and for everything that you do.
Sure. Thank you, Anne. And we do have a couple of questions here that I'm going to pass on to my colleague, Elizabetta. So, Elizabetta, one of the first questions we had was asking about tiered reimbursement rates. And just, we will be talking about that at our third webinar. But they did ask if those rates are going to change for quality rated schools on September 29th as well.
Yes. So if you recall, we increased each tier level by 15% with some of that extra COVID-19 relief funding, the ARP funding that I mentioned earlier. So those 15% increases are definitely ending September 29th because we do not have that funding anymore. We will be talking in, I think, the third webinar about details about what will replace the tiered reimbursement on, I guess, the next day, the day after it ends, after September 29th, so September 30th, what's coming for tiered reimbursement will be discussed in detail in the webinar we're having in August. So yes, there will be changes. Yes, that increased tier is ending, but more details to come on what is replacing it.
And again, that increased tier was related to the American Rescue Plan funding too,
Yes.
which is ending.
Yes, exactly.
Sure. Elizabetta, we also have a question here about foster children and their certificates. And someone asked if the changes applied to those as well. They thought foster care paid the published rate even before the pandemic.
Yes, and we will continue to do that. Think of it this way. We will be going back after access ends to our old policy with regard to what rates and paying state maximum reimbursement rate. Those rates are going to be different. And again, we'll be talking a little bit more about that in the next two webinars and specifics on it. But we will continue to pay the published rate for children who are in our foster care or DFACS custody priority group, as well as for children with disabilities. So those two priority groups prior to access, prior to the pandemic, were already paid at the full published rate, and we will continue to pay those at the full published rate.
Yeah, and before we get to the next question, I do want to point out that we have several people raising their hands. We would like you to put those questions in the chat, in the Q&A, please, and we'll be able to answer them there. And again, if we can't answer them today, we'll answer them in an FAQ posted later. So, Anne, I hope it's okay with you. I'm going to put you a little bit on the spot here with one of our questions, but there's been several questions, and I know you covered this in your presentation about holiday billing. And if you could just repeat some of that and explain a bit again about how to do holiday billing around July 4th and Memorial Day.
Absolutely. Can we go back a slide? Would that be possible? So it might help to be able to have the visual as well. Okay, so you're going to go forward a couple. One more. There we go. Okay, so if you were closed one day, maybe several days during a week, but you were open at least one day, then what you're going to do when you see that prompt that says, were you open during the service week, you're going to select yes. And that will allow you to be able to complete the attendance for that child. You can go ahead and go to the next slide just so they can see. I think there's another question as well, since we're advancing the slides back a little. There was another question about holding slots policy. So can we go back to that? There you go. So this is the policy right here that CAPS may authorize payment to a provider to hold a slot for a maximum of 2 service weeks during the eligibility period when the child is absent from care, but they need to be open for business in order to receive payment for holding slots, and must include specific payment requirements for holding slots in your policy. So again, you do definitely want to check your policy on file and make sure that that's there, that you have the holding slots there. Also, the child must have attended the provider in person at least once to claim a holding slot.
And we have a question here about documentation around the homeless priority group, and specifically asking what documentation would someone give to prove that they are homeless now with the changes?
Olivia, do you want to take that one?
Sure, I can take that one. Okay, so previously shared that verbal attestation is no longer an acceptable documentation source for families who lack fixed, regular, adequate housing. However, a parent can still submit written documentation of verifying their priority group, as well as if they're in a shelter, a letter from the shelter, or if they're living with someone temporarily, the person that they're living with can write a letter stating that this family is living with them temporarily, and the letter doesn't have to be notarized. So those are some of the verification documentation that can be submitted for the families who lack fixed, regular, and adequate housing priority group.
All right, thank you, Olivia. And Elizabeth, we have a question here about the week of June 3rd and one of the new waivers. So if for the week of June 3rd, if a child did not attend, was that waiver still in place for payment?
Yes, that, if June 3rd is a Monday, which I don't have something in front of me to be sure about that, but assuming that that is a Monday, that would have been, I think, in the last week that was covered by our, what we refer to as our COVID billing policy. So if you billed by June 11th, because that was the cutoff to do it, then you would get paid your full rate, even if that child didn't attend. The next week after that was when that waiver ended, and the children had to actually attend at least once during the week in person in order for you to receive payment. And that's what's in place now.
Thank you. So we have a couple questions here about notifying families about the change and the changes with the new rates, and when we're going to make sure that families are notified, as they will now be responsible for that differential. So can you talk a little bit about that?
Sure. We are doing letters, and generally, whenever we make any major changes, you guys receive a letter, childcare providers, and families receive it as well. And so we'll be doing letters to them and about the end of access, what their parent responsibility will be. We will go over all of that with them, as well as our staff as they talk to families, share information as well, so that they're clear on exactly what they're supposed to do. In addition, there was a second part to that question.
Just about communicating with families, and so they can make sure about the differential.
I remember. I'm sorry. So when access ends and we switch back to our state maximum reimbursement rates, even though those rates will be different than what they were before, but when we do that, we will reissue new scholarships for everybody, because we need the right information of what the family fee, the parent responsibility, what the new state maximum reimbursement rates are. And of course, what's currently in place is what's on the scholarships now. So we will reissue scholarships. So in addition to the letters that we send and the conversations that we have, families will receive new scholarships. And of course, all those scholarships will also be updated in Georgia CAPS for you to be able to view them. So that is how families are communicated with.
Okay, and I think along that line, we're getting some questions, and for some of the questions are for persons who joined the webinar a little bit late and asking, some of the why are we making these changes? And I know you covered that at the beginning, but it might be helpful to cover that again.
Sure. The quick summary of why we are making these changes are really mostly because of our American Rescue Plan funding is ending and has to be spent by September 30th. And we don't have, that was additional extra funding that we had to pay for these things. Our typical CCDF funding supports what we were paying for before, as well as 50,000 children versus the over 72,000 that we got to at the highest point. And so there's that. We also got new CCDF rules that were issued to us that we have to think about how we will implement them. They're impactful as far as how we pay childcare providers. And so once we figure out exactly how that's going to work, of course, we will definitely communicate with you what all of that is and what those changes are But that also may have impacts on the number of kids we serve. So we need to make changes now in preparation for that. And then, of course, we have a new state plan, which is what CCDF, Child Care Development Fund, requires us to do every 3 years, of how we will administer the program and how we will follow all their rules. And in that new state plan, there are new reimbursement rates. And so these are the reasons for some of these policy changes now. And the way that I talked about that we needed to reduce from the over 72,000 children at the highest point, not sure that that's exactly how many we have today, but to the 50,000 number of 50,000 children. I want to say a little bit more about that. So it's not that we're going to reduce to 50,000 children by October 1st. It's that we need to go ahead and implement changes to get that down. Our goal is to do this more gradually, because that will help ease the change for childcare providers. But it's not, I don't want to make it sound like it won't have any impact, like you won't have any feeling from it, because obviously the program will be caring for less children, which means you get paid for less children than you did. But we are returning to the service levels that we had before. So it will be similar, if for those of you who've been in the program since before the pandemic, to that time, except with different higher payment rates. So I hope that answers that question, and in a nutshell, at the very least. So just really quick, we have to, because of federal regs, changes in federal regs, the end of relief funding, and the new CCDF state plan, we have to make some policy changes. We need to reduce back from the number of children we have now to 50,000. And we will be paying new rates starting on September 30th, 2024.
And again, I think while we were very thankful for the additional federal funding and all the things we were able to do in that time period, we knew that it was going to end on September 30th. And so that's what we are working with now.
Yeah, that's a great point. And it was wonderful that we were able to serve for several years a whole lot more families, and to pay providers their full published rate, which is historically has never happened in this program before.
Okay. So going from the policy back to the technical a bit, I'm going to look at my friend Ann here, who I know has been monitoring the questions too. And I think there's a couple questions here, Ann, you'd like to answer.
Sure. So there was a question about the 2-week holding slot. So yes, it is 2 weeks, regardless of what the reason is. That is all that we're allowed to reimburse for that holding slot policy, is the 2 weeks. So I was able to capture that question.
But we did also have a question that said, if they're gone for more than 2 weeks, would we still pay? And CAPS will not pay more than 2 weeks to hold a slot for a child, but providers can charge the family in those situations. So CAPS will pay 2 weeks while the child's not there. But if the child if they have the holding slot on file, and if that's been approved. But if it's more than 2 weeks, the provider then will need to collect payment from the parent, because CAPS will not pay for more than that 2 weeks.
But they're allowed to, right? A child care provider's allowed.
Yes, they're allowed to. They don't have to, but CAPS policy allows them to do that. That's right.
I'm going to go with the assumption, because Kay, you're a little farther down the table, so I'm not sure everybody could hear that. Elizabeth or Ann, y'all are closer to the microphone. Do you mind repeating that?
So you can put in to get payment from CAPS for holding slots for up to 2 weeks. And you have to have that in your policy and approved in our system on file with us. But if you do, then you're permitted to do that. And you'll be able to see that option in the billing portal if you are in that state of being approved to do that, and it's in your policies. And if a family is out for more than 2 weeks, you are allowed under CAPS policy to charge that family whatever you would typically do with your private pay family.
All right, perfect. All right. So we've got two questions one about will the webinars be recorded? So yes, this webinar is being recorded, and we should have it posted within the next day or two. And I think we're posting it both to the CAPS policy page and then also to the page on provider relations, if I remember correctly. So you'll be able to find that in two places. We'll also be doing a FAQ. The questions really came in at the end of the presentation, so we were doing our best to monitor them. We will collect those. We will try to simplify those and make them more general, and then just give us some time and we'll be able to post those at the same places that we post the webinars. And then the last question that we had were, when are the next webinars? So let me just go to the next slide and we'll end there. So on July 23rd, we'll kind of go into a little bit more, I would say a little bit of almost a deeper dive into some of the things we talked about, along with some new things where Ann and Kay will be talking about, how to update your rates in Georgia CAPS and some of the time frames, as well as just some other things around our new rates. And then next slide. And then on August 13th, we will be talking specifically around tiered reimbursement, the changes to tiered reimbursement, the changes to our CAPS base rates. We'll also be talking about some new workforce bonuses that are part of our state plan. And then we'll be able to offer some new resources that we'll be talking about through our DeKalb Thriving Childcare Business Academy. So with that, I want to thank you all for attending. I know this is a lot of changes, and we know that's a lot. We are doing this as a series of 3 webinars just because of the volume of information. Please reach out if you have any questions and look for this to be posted and our FAQs. And Elizabetta, I'll give you the last word. And you didn't know I was going to do that.
No, I did not. Just the same. Thank you so much. We truly appreciate what you do. We truly appreciate the care that you provide to the children that are enrolled in the CAPS program and all the children that you serve. We know that it takes a lot of time and that you wear a lot of hats. So thank you for taking the time out today to hear about these changes. And we will be, trying to make sure that you're well informed about everything that's happening. Thank you.